Implants, in my opinion, are probably one of the most significant impacts on the field of dentistry that's been made available and more readily available throughout the years for the past 20 years. Dentistry improves over time, so do implants. The major benefit of implants is it's the next best thing to your natural tooth in the mouth. There's lots of ways to replace missing teeth, but if you have a single tooth that you're missing, the most natural feel, the most natural look, and the most healthy way to restore that space is with a single implant. It doesn't negatively affect the other teeth, and it restores the space functionally and cosmetically. Whenever someone comes in with missing teeth, you're basically going to have three options. You're going to have implants, you're going to have bridges, and you're going to have some sort of removable prosthesis. And there's advantages and disadvantages to all. In most cases, I feel like implants are going to give you the most benefit at the least cost overall to the patient. Bridges are great and they have their place, but oftentimes a bridge is at the cost of another tooth in the mouth because you have to prepare other teeth to accept that bridge. The benefit of an implant, if you're missing one tooth, you don't affect the rest of the teeth negatively. If you're missing one tooth on the upper left, the dentist prepares the one spot for a screw that goes into the bone with a crown that goes on top. You'll never get a cavity. And a lot of times I tell patients, if you can make it through that first 6 months, let the implant heal in the bone. Let the body accept the implant. You still need to brush and floss around it like it's a regular tooth. There's no cheating here. But you've taken the cavity aspect out of it. You can still get gum disease around implants, but ultimately we're finding that implants can be the most successful thing, predictable thing we can do in dentistry. The average implant case involves the patient coming in for basically 2 visits. One is to place the implant. It's a relatively easy procedure whether the tooth is there or not. If the tooth is there, you can pull the tooth and place the implant the same day. Other times, if the tooth is already missing, all you have to do is put the implant in. You let that heal, usually for a period of about 3 to 4 months. Then the patient comes back, takes an impression, and 2 weeks later you have a crown. Restoring the space that someone may have in their arch of teeth, it lets them smile where there's a space. It lets them chew and food doesn't get stuck there. It doesn't let the teeth drift. You don't want spaces anywhere in your mouth. And what implants allow you to do is a minimally invasive way of restoring your teeth to where they should be. Implants has restored the confidence in our patients to be able to function again as if the patient had teeth.